So let's discuss Babesia symptoms versus, because that's a protozoa, a little bit different, and then bacterial symptoms, and that's where you have the Borrelia and the Bartonella. But let's go through the symptoms because this is where I'm hoping you'll either resonate and then be prompted to take action, or hopefully say, no, none of this sounds like me. But let's go through. So again, Babesia is a protozoa, so it's a more advanced bacteria, essentially. It's known as an intra-erythrocytic, so inside the erythrocytes, the red blood cells, parasite. It can cause damage to the mitochondria, and it can also, through infecting the red blood cell and consuming nutrients in the red blood cell, lead to anemias. This is why we can see the key symptoms of fatigue, especially if it's marked fatigue, and this feeling of air hunger, like you can't get a full breath. These are some hallmarks of Babesia. Babesia can also increase the viscosity or the thickness of the blood. And this allows it to sort of impair circulation to multiple parts of the body, including the brain. Now, this can lead to things like brain fog, potentially fatigue, but it can also lead to this feeling of a lack of coordination. You're a little bit tippy or off balance, or you just don't feel steady. Because Babesia can either infect the brain through the red blood cells or cause a reduction of circulation to the brain by making blood more thick, more viscous, it can cause autonomic dysregulation. So the autonomic nervous system, you have your sympathetic, fight or flight, you have your parasympathetic, rest and digest. When the ANS is dysregulated, you can have any one of a number of symptoms, including an elevated heart rate at night. And this accounts for why some people will say, I'm lying in bed, I've had my pre-bed routine, haven't had caffeine late in the day, all the things are being done correctly, yet I'm still lying in bed feeling like I'm wired and wide awake, or maybe even like my heart is going a little bit fast. This is because you're in fight or flight when you shouldn't be, which is downstream to the autonomic regulation. So from that follows, logically, insomnia can be caused by Babesia. Another very hallmark of Babesia would be unexplained fever, night sweats, chills, or hot flashes. And these are all secondary to dysregulation of the autonomic nervous system. Something that I wanted to thank Dr. Brandeis over at iLads for pointing out to me is panic attacks that last longer than 1 hour. And panic attacks and anxiety, it's a little bit blurred in terms of how we distinguish one from the other. But nevertheless, if you're having a panic attack or a very, very, very anxious state for longer than an hour, this might be Babesia. And of course, again, Babesia can cause digestive symptoms. So this is the one organism, the protozoa. Now, the other camp would be the bacteria. And by the way, if this has been helpful, please comment and subscribe. I really do appreciate hearing what people think, so I'll look forward to reviewing your comments. Taking a step back, the reason why I separate these as such is the treatments tend to be a little bit different for a protozoa as compared to a bacteria. Yes, there's some overlap, but this is why I frame them as such. With Borrelia, Lyme, and with Bartonella, here are some of the key symptoms. Remembering these are bacteria, and especially but not limited to the Bartonella, it can infect the lining of the blood vessels. And this can impair circulation for different reasons. So while Babesia will make blood thicker and harder to get into microvasculature, brain, genitals, just as two examples, maybe the end of the hands and feet, Bartonella can infect the lining of the blood vessels and cause damage there and therefore impair circulation in a different way. Now, interestingly, Bartonella can infect the bone marrow and also, again, infect the red blood cells. It's possible for these bacteria to directly infect the immune cells, so the microglia in the brain and the macrophages. This is akin to if you have warring countries attacking their military bases, right? So this is one of the things that I find most potentially problematic about these bacteria is that they actively target your immune cells. Whereas the Babesia will slow down circulation, these organisms can form biofilms, which can be part of the reason why there's chronicity, meaning that they don't fully go away with treatment, is because they can hide behind these biofilms. Now, this is all able to be treated, but just want to make you aware. So the other thing here to key in on with these two bacteria is when you see a predominance of neurological symptoms, you're thinking these bacteria, as compared to the protozoa, could be present. So when I say predominance, it means that if someone has 6 symptoms, 4 of those 6 are brain-related: brain fog, depression, anxiety, maybe neuropathy, okay? So brain fog, cognitive impairment, anxiety, depression, cramping, which is oftentimes neurologically mediated, muscle twitching, and neuropathies. So this is something really to cue in on, is when you see someone who has a lot of cognitive or neurological symptoms and there's no other good reason why, you may want to be thinking about Bartonella or Borrelia. Also, a couple other hallmarks, especially of Bartonella, are pain, shin pain, tooth or gum pain, pain on the soles of the feet when waking up. So the first few steps kind of hurts. That's because of impaired circulation clearing from the bottom of the feet. And so the pads of the feet feel swollen and tender for the first few steps in the morning. And again, because there is this impairment of the endothelium and therefore circulation, you can have red eyes, you can have spider veins or broken blood vessels. And additionally, especially with Bartonella, there's something known as Bartonella-associated skin lesions. And this could include, and I'll share a few visuals for those of you who are watching this, stretch marks known as striae, or what look like funny pimples known as bacillary angiomatosis, or even something different known as petechia, which are these small circular bruise-like dots, essentially. So it's not a one big round bruise like you hit your thigh on a coffee table. It's a number of small, sort of pea-sized or maybe a little bit smaller circular bruises that can come and go. And again, this is due to the fact that circulation and the endothelium can be damaged. And again, there can be chronic digestive symptoms from either the Bartonella or the Borrelia bacteria. So that's your rundown. It covers a lot of symptoms. So then how can we go a step further to try to quantify what seems like a large list of symptoms into a score? This comes back to that questionnaire I mentioned earlier, validated by Dr. Richard Horowitz, called the MSIDS 38, MSIDS 38. It's 38 questions that Horowitz validated can be predictive of if an infection is present. Now, you can very easily search this online and go through the test on your own. You'll see the scoring, and usually when you pull up the questionnaire, the scoring is barred at the bottom. If your score is less than 21, that's considered normal. If your score is between 21 and 45, that indicates an infection is possible. And if your score is above 46, that indicates an infection is probable. I really appreciate this because it simplifies the next step, which would be take the questionnaire, and if you score probable or possible, then perhaps do some testing.